The Drug Enforcement Agency created a system to classify substances based on their acceptable medical use and potential for abuse. There are 5 categories, starting with Schedule 1, going in decreasing order. If you look at this chart here, it tells you the schedule of the drug, the medicinal use, potential for abuse, potential for addiction, and examples. Schedule 1 drugs include LSD, heroin, and currently marijuana, all the way down to Schedule 5, which has the lowest abuse potential, and this would be cough syrups. Marijuana is currently classified as a Schedule 1 substance under the Controlled Substance Act, an act under federal law that places substances into one of 5 schedules based on their medical use, potential for abuse, and safety or dependence liability. President Joe Biden has ordered a review of the drug, potentially allowing the DEA to reclassify it as a Schedule 2 drug. Schedule 2 drugs have high abuse potential but are accepted as medical use, and these would include morphine, oxycodone, fentanyl, and Adderall. Hopefully with the evidence I provide, you will be convinced as well why marijuana should be reclassified from a Schedule 1 to a Schedule 2 drug. Veterans are turning towards medicinal marijuana to relieve their chronic pain and treat their PTSD instead of turning to more harmful opioids or painkillers. According to their website, the Veterans Cannabis Project works to advocate, educate, and heal veterans through supporting and fighting for medical cannabis use. Founder Nick Enton states 60% of what the VA treats can fall into the category of chronic pain, and the system was not designed to do much more than push pills. A 2011 Department of Veterans Affairs study found that veterans were twice as likely to die from opioid overdose compared to the rest of the population. Phil Rowe and Tim Walz, House Veterans Affairs Committee chairman who introduced the VA Medical Cannabis Research Act of 2018, state 22% of veterans report using cannabis as a safer and more effective alternative to opioids and drug cocktails currently prescribed by the VA for medical conditions such as PTSD or chronic pain. Now that we understand the first reason, let's see how it benefits cancer patients. Cancer patients have stated how marijuana has helped them in several ways. According to the National Library of Medicine, marijuana has been found to ease nausea, suppress vomiting, increase appetite, relieve pain, and soothe anxiety. A man who suffered from cancer and later died from cancer tried marijuana, and according to his wife, it made his last couple of months more bearable. According to the American Cancer Society, studies have shown that people who took marijuana extracts in clinical studies needed less pain medicine. Medical News Today states that mouse studies have indicated that purified extracts of marijuana may slow the growth of cancer cells in one kind of brain tumor. Now that we know how it helps cancer patients, let's look at our final reason. Marijuana has been found to treat chronic pain and is a muscle relaxant. According to Harvard Health Publishing, marijuana has been able to lessen tremors for those who suffer from Parkinson's disease. According to the National Library of Medicine, studies show that there has been a 64% reduction in opioid use amongst people who suffer from chronic pain. Patients have claimed marijuana allows them to resume their previous activities without feeling completely out of it or disengaged. If we look at this chart for cannabis in chronic pain, it's the number of deaths involving opioids in the USA, and as you can see, from 2002 to 2017, the number has skyrocketed exponentially. One of the most compelling arguments against the reclassification of marijuana is that it serves as a gateway drug to harder substances. This simplistic argument ignores the increasing body of evidence in support of marijuana, but the majority of individuals who use marijuana do not then move to harder drugs. While I am fully aware of the downside of making marijuana more accessible, including overuse and possible addiction, the documented upside is compelling. Marijuana has been found to help veterans cope with their PTSD and other related traumas, allows cancer patients some relief, and helps those who struggle with chronic pain. That is why I support reclassifying marijuana from a Schedule 1 drug to a Schedule 2 drug. Thank you.